Yeah, good morning, everyone. Hope you are safe and doing good. Welcome to the fourth day of Medinvate 2021. Today we have our first event, a road to German medical post-graduation. Today we have our honorable speaker, Dr. Oshin Behl. She is a doctoral student at the ENT clinic at the University Hospital in Germany. She is the founder of the Instagram page Journey to Germany and the Global Consortium of Medical Education and Research GCMER, which is a network of creative research oriented students and is now being established in Bulgaria, Ukraine, Kyrgyzstan, Georgia, and Nepal. She has worked in Germany for 14 months till now, both clinically and in the lab, for which she awarded the Coaching Fund. Today we have felt very grateful to have you, ma'am. So please watch this exciting webinar and shoot your questions related to Germany physics. Hand over to you, ma'am.
Thank you very much, Tarun. It is an honor to present over here today because it is also being held in association with a lot of organizations which I'm very close to, other than GCMER. Actually, I was a part of the European Student Think Tank, a member of which is actually a part of the team of this organizing committee. And I would like to thank you for the opportunity to let me talk about this very important topic, that is a road to German medical post-graduation on behalf of GCMER, which is the Global Consortium of Medical Education and Research. If anyone wants any more details about GCMER, we can talk about it at the end of the webinar. And at any point, feel free to write in the chat if you have any questions, because I am used to a Zoom call, a sort of webinar where I can see the questions so I can directly answer them. But now you have to write your questions more actively and keep writing them if they are not noticed. But I hope I'm able to be as interactive as I would have liked to be. And with that, we can start today's session. Uh, Basically, today's session will help anyone sort of be clearer about whether they want to pursue PG in Germany, what goes behind pursuing PG in Germany, etc. So let's start with the objectives of today's video. The first objective is to explain how the PG system in Germany is different but similar, because that is where the question starts, because a lot of students are confused about the PG system in Germany. Then what the requirements are, both academic and non-academic, the current situation with respect to India, getting there, coming back, etc., the visa, the PG validity, all of that. Then all of the exams that you have to give, because I know that a lot of the other exams like USMLE and PLAB to basically go to US and UK respectively are very commonly spoken about, and it's something that's in the mainstream. But the exams related to Germany are actually not very well known. A lot of people think that you don't have to give any exams other than the language exams. That's wrong. So I'll be talking about that as well. And also, I'll be talking about the alternative paths. Honestly, I am on an alternative path. I'm not on the straight path, which I will be describing in detail. But in the end, I'll also be talking about the alternative paths. Other than this, you can always approach me through the means that I'll be talking about. If you want to come up with a personalized plan, if you have any questions. So yes, you can always do that. Just a small disclaimer that all of this is based on what I have collected on my experience. I know there are many channels which talk about German PG, and they might actually come up with some different information, but trust me, most of the information is going to be similar. But some of them, like for example, the alternative paths, may be different because it's based on my experience. And feel free to contact me about any of these. The details, as Tarun said, would be put in the chat. The email address is gcmedicalresearch@gmail.com. And we also have an Instagram page, which is gc.mededures, that is Global Consortium of Medical Education and Research. So you can reach me over there. And now we can start with the actual content of the video. So the PG system in Germany, firstly, it is usually around 5 years, that is 60 months for medical, and 6 years, that is 72 months for any surgical PG. Also, in the meanwhile, while I am talking about this, I want you to tell me if you have seen our video that is on the GCMER YouTube channel related to PG in Germany. And so then I can even skip through it if Tarun tells me that a lot of people have seen it. I don't even know how many people are viewing this because yeah, I don't have access to the YouTube live stream. So yeah, just let me know. Another very special thing about PG in Germany is that you directly enter into a super specialization. You don't have to go through a specialization and then a super specialization. You directly enter it. Of course, this has its advantages and disadvantages, which I can elaborate on if required. There are also no yearly exams, unlike a lot of other PG courses. In Germany, there is just one exam at the end of the whole PG, and that basically qualifies you to become a specialist. PG in Germany is also considered a job, and that's why it's very important to look for vacancies in the state. That is, there are 12 provinces in Germany, provinces or states, and you have to look at the PG position as a job vacancy in the state in which you want to get the PG program. And again, every state has a different passing examination based on the state. Of course, the overall procedure is the same, but the difficulty level, the examiners, the topics covered, all of that varies from state to state. So again, you have to focus on which state you want to go to, and then look for vacancies accordingly. Another thing which I didn't know that many people don't know about is that there is no fee for post-graduation in Germany. So I guess this makes it stand apart from PG in India, especially because I know that there is no fee for post-graduation even in the US and in the UK. But again, in Germany as well, there is no fee for PG, and you get paid a very decent amount of money. And this, what I'm putting here, that is 3,000 to 4,000 euros. You guys can convert it at the rate which it is going now. That is, the Indian rupee is at about 80 to 85 compared to euros. And this is after taxation. So when I say with 30% taxation, I mean after taxation, it's about 3,000. In some states, it might vary up to 4,000, but I haven't heard about it, but it is said on paper that it can. But yes, the basic salary, I would say, is about 3,000 euros a month. Again, depending on your marital status, depending on the state, depending on if you have any children, if you happen to have children. So yeah, all of that, plus health benefits, which is free if you become an employee in Germany.
Madam, students are saying that they haven't watched the previous video in
Okay.
GCMER, so they
Okay.
want elaboration.
Okay, great. So that's good because this is sort of very similar to that, because this is basic, and I thought so that like many people must not have watched it. So at any point, feel free to put any questions in the chat box, and Tarun can always interrupt me, and that's fine, no problem. We have someone trying to enter the room. Is that, yeah, okay. So now coming to the advantages and disadvantages, because we spoke about the basics, now we can get into the comparison. So I would honestly say that there are better chances of getting into the super specialty that you want. And there are a couple of reasons for this. The first reason is that since you're getting directly into the super specialty of your choice, there is a much higher chance that you will even do a super specialty. For example, in India, you first have to do a basic course, for example, medicine or surgery, if you want to become, for example, a cardiologist or a cardiothoracic surgeon. So, in that case, you have to do the basic of this, and then you have to do a super specialization in that field. Many a times what happens is that since there is an exam at each level, many specialists after doing their post graduation, like the first level, either lose the motivation to do super specialization that they had planned for, or they don't get into a super specialization. We know it's very competitive. So that is one of the reasons why this might happen. The second reason is that since you're getting directly into a super specialization, you know what your super specialization is going to be. Other than this, you can change your super specialization in the first 2 years of getting into a super specialization here. I know of a doctor who got into plastic surgery because that was the thing that was available. And then they performed really well in the surgical training, and then they switched to neurosurgery. So that is a possibility. Other than this, Germany is always looking for doctors, some years less, some years more. But overall, they are always looking for doctors. So that's an advantage, in my opinion, a big advantage. And of course, compared to India, there are better standards of living. I personally believe that. I have stayed here for a while now, and I can definitely say this. There are also better professional ethics, I would say, because over the past 2 years, especially, I have seen so many like areas and times when Indian doctors are honestly not respected. They are respected superficially, but when it actually comes to respecting the profession, when it comes to giving credit where it's due, there Indian doctors fail. And that's not because Indian doctors are bad at their training. It's just that in a country where many things you have to fight for, sometimes things like this can happen. So obviously, with better standards of living, people's priorities change and they are more focused on professional ethics. Of course, this applies to the work ethics in the hospital and also the sort of stand you have in the community. So, of course, I think it's much better over here. Additionally, there are also better rewards for work. And I know this sounds very, I don't know if someone is going to say that, oh, you shouldn't think about rewards for work. But I think that getting the right reward for your work is very important for you to continue having the same excitement for your work. And over here, for example, if you do an overtime, if you are exceeding certain hours in the week, they either pay you extra depending on how much overtime you're doing, or they just tell you that take a break, because they will not let you work beyond certain hours, which is not the case in India, even if on paper it is said so. I know for a fact that it is not. And of course, Germany is known for its advanced surgical techniques. Medical techniques, of course, the research is much more advanced, but I would not say that India is falling behind. Of course, India is coming up with research. But yes, in surgical technology, definitely Germany is light years ahead. Of course, there are some disadvantages because the language is different. You have to learn the language to get into the post graduation, and this can be difficult for some people, while for some people it's extremely easy. It always depends on when you start learning the language, because if you start learning the language early, firstly you're younger, so it's easier for you to learn the language, and secondly, you have less pressure on you, because if you start learning the language after you've completed your MBBS, then you'll be in a position like me where you're thinking like, oh, I have to be on this timeline, so what am I going to do? Of course, there are alternatives in which you don't have to waste your time while you're learning the language, which also I'll be talking about. But yes, the earlier you start, the better it is. The second disadvantage, obviously, is for some people, the new country, new people, all of this can be a little anxiety inducing. It can be scary. I know a lot of Indian parents who are sort of against this, like, like going to another country, because I have conducted this webinar so many times, and so many times I have gotten this question that I decided to include this as a disadvantage. Because many people used to go like, how can I convince my parents that I should be able to move to Germany? It's a great country to live in, honestly, I can assure you of that. And also, with the better work ethics come the stricter work rules. In the sense, there are no loopholes. You have to do things very systematically. You have to be very punctual. There are no shortcuts, because the German medical system, and honestly, German society in general, believes in like hard work and doing things the way they are supposed to be done. And this puts a lot of pressure on doctors as well. But I know for a fact that the system here, at least, is better than the system in the US. Because in the US, a lot of people are on private healthcare, and because of that, doctors become much more liable, that is, legally speaking. But since over here, most people are on public healthcare and the pay is like centralized, because of that, the liability obviously decreases, and people don't have to be scared of like what the patients are going to do, like it is in the US and also in the UK. So, coming to the second objective, that is the requirements for the PG. If anyone has any questions about the advantages and disadvantages, which was sort of the general part, you can put it in the chat box and I will take them at the end of this section. So the requirements for the PG, firstly, of course, MBBS degree is required. You can't start the PG process before you complete your MBBS degree. And also a work experience in a hospital is very important for German PG. Similar to electives and clerkships in the US, Germany also has the system of hospitation, which I also did when I was in my intern year. But unlike the US, where you have to complete the electives before you complete your internship, because otherwise you're not considered a student, and because of that there are liabilities, so then you have to go as an observer. Over here it's not like that. If you go to a hospital where they are able to give you practical work, they'll let you do it if you are a student or if you're not a student, that doesn't matter. And definitely I would like to focus on this, because now German PG is becoming so competitive. Germany opened its borders in 2012 for international medical graduates, and it's not been very long, because considering like the emigration cycle, 8 years is not a long time. So now things are getting very competitive, and because of this, your CV matters a lot, other than the basic two requirements that I have mentioned. And teaching experience is something that a lot of UK students actually ask me. That is, students who apply for PLAB, they think that even in Germany, because it's part of Europe, that teaching experience would be necessary. It's okay to have it. It's not important to have it. I would say that. Now, research for Germany, I would say, is important because a lot of students in Germany pursue this degree called a Doctor Med, which is what I'm pursuing right now, which is basically a research degree. And this is something which is pursued by approximately 50% of German medical students. And it is a part almost of their undergraduate, even though it is considered to be a post graduation. It is done by them along with their UG. So if you try to do research after you have completed MBBS and you say, okay, now I want to start doing research, then you might just waste time, unless you're getting a degree, of course. So as I said, they've published a final thesis at the end of their medical degree, which also I'm going to be doing. But if you are in your third or fourth year and you don't have time, so fear not. You can always do basic research like doing Google form-based surveys and collaborating with professors so that it's easier to do the research work. And also, like, for example, in GCMER, we have students who collaborate with each other and they publish together. Like, they write a review or they do some original research based on Google Forms, or they see in which hospital, which patients are found. And then based on that, they can do the research together. So that basically takes the burden of doing it alone. Before moving on to the next part, I want to answer any questions. Are there any questions? I can't hear you if you're saying anything, Tarun.
Yeah, sorry, ma'am. Like it's in mute. So, yeah,
Yeah.
like we have few questions, but you have covered it in the slides. Like one of
Hmm.
the question is like, please elaborate, ma'am, how to go about super specialization, and
Hmm.
ma'am, that PG certificate is valid in India after PG in Germany, like which we will cover post
Yeah.
webinar. And if you are asking that pharmacy students and physiotherapy students have any paths which you can address at end of the video. So which exams we have to give for completing MBBS from India for PG Germany, which you have already covered. So does 5 years include PG plus super specialization? And the work experience should be from Indian hospital or German?
Mm-hmm.
So, and I have finished my MBBS and have some work experience, but I have not been involved in any research. What would you recommend me to do in this regard?
Okay, so answering a few of the questions, the other ones I can take in the end. Now, when I said that German PG is super specialization, if you choose to do it, that is exactly what I meant. It's not that PG including super specialization or excluding super specialization. For example, if you want to get into neurosurgery, which is a super specialization in India, then you will get to neurosurgery on day one of German PG. If you apply for a vacancy and it's available and they accept you and you pass the interview and everything, you will get into neurosurgery. So yeah, that's what it is. If you want internal medicine, again, it'll take you 5 years to do it, because any medical PG takes 5 years, surgical PG takes 6 years. So there's no difference between like a specialization, super specialization. It's not divided like that. It starts from the very beginning. And other than that, the exams which you have to give to get there, I will be talking about that right after this section. Because in this section, I'll be answering the question about whether PG in Germany is accepted back in India. So yes, we will be getting to that. So, to get to Germany, now after you have completed your MBBS, which was another question, by the way, that I've completed it and I have work experience and I don't have any research experience. Yes, I will be answering that in detail. So coming to the visas, it's pretty general. You have to either get a student visa, which is the commonest form of visa that a lot of students get, because you can either enroll yourself in a course over here, because that's much easier to do than to wait in India till you actually get a job over here and then apply for work visa. Another thing you can do is you can enroll for a language course, because you have to do it anyway. So a lot of students do go by this option. But again, this involves some financial burden, because the courses over here are a little costlier than in India. Even though it is standardized by Goethe, it is a bit costlier over here, of course. And of course, you can always apply for the work visa once you have gotten a job. But again, there are some alternative paths in which you can get a research position and apply for a work visa and then come over here and give the exams and apply for a super specialization. And the language level B2, so in Goethe and normally in general, if you talk about German language, there's A1, A2, B1, B2, C1, C2. C2 basically is equivalent to doing a PhD in Germany, in German, sorry, in language German. If you want to do a PhD, then yes, C2 is the level for you. But to apply for a residency, you need to complete B2 level. Even to qualify for giving the entrance exam, you need to complete B2 level. That's why wherever you are right now, at whichever point in time you are, start learning the language today if you plan on pursuing German PG, because I know people who have completed their language courses in 8 months. That is 2 months for each level, A1, A2, B1, B2, and they have completed it. So it's not hard. Trust me, if that's the only thing that you're dedicated to, it's not going to be hard. So don't worry about it. And then, yes. So coming back to India, that was the question that was asked. So till now, Germany accepted Indian MBBS, as I said, in 2012, but India has not started accepting German PG yet. But I do know that in a lot of countries, what happens is that a few years after most of the patriots, that is Indian people who have come to Germany, completed their PG, want to come back to India, that's when the government starts considering it, because now it hasn't been long enough for the people who started their PG to complete it and go back to India. So I'm assuming that by 2022 or 2023, things should be a little clearer, because by then a lot of people will be planning to go back to India. But considering the state of affairs in India, to be completely honest, I don't know how much the government will be pressurized to do this, because I mean, people who come to Germany to do PG tend to settle here, because honestly, the life here is easier, it's better, it's more rewarding. So yeah, it's about that. You might want to go back to India and establish your practice. I can look into this, because I do get this question a lot. So maybe I'll include it next time, or I'll post about this on the GCMER Instagram page. Now, coming to the exams that you have to give, which was another question which was asked. So in German, exams are known as Prüfungen. Some German language lessons for you. The U with the two dots on top, which are called the umlaut, are pronounced as U. So it's Prüfungen. And the exams to give are, of course, starting with the language exam, that is B2, which you can give through the Goethe Institute, which has training centers in India, Germany, everywhere. It's the same certification. It doesn't make a difference if you do it in India or Germany. You can also go through other language levels, like there is another institute called Test DAF, but that has different language levels. So you have to be sure of which language level to apply for. The second exam, which is very, very specific to German PG, sort of equivalent to the language exam that happens in PLAB, where you have to examine a patient and they sort of see your communication with the patient. This is similar to that. And since in Germany, if you want to practice as a doctor, and especially because PG is considered to be a job and you are thrown into the hospital on the first day of your job, you're expected to communicate with the patients. And since all of them speak German, your German communication needs to be A1 at B2 level. So the exam is called Fachsprachprüfung. That is a medical German specialty exam, which is something that you have to give after you have completed your B2. So once you complete your B2, you can contact the STARTS examination department of every state, and they will correct your documents. They will rectify if they are matching. They always match. There's no problem with that. How much time that will take is different from state to state. So some states take around 1 to 2 months, and then you get an FSP date, that is Fachsprachprüfung date. Some states take 6 months. I know that in Saxony, that is the state that I live in, it takes about 2 months. It doesn't take more than that. Then after this, you need the Approbation. If you read it in English, it reads as approbation, but it's actually Approbation, also known as the Kentness Proofing. Because the Kentness Proofing is the name of the examination. By the way, don't get scared of the big names. Once you start learning German, it'll be very easy to break it down, and it'll be easy, trust me. And then the certification that you get is known as the Approbation. So the exam is Kentness Proofing, the certification that you get is Approbation. And this sort of gives you the opportunity to enter into a post-graduation course. That is, once you clear the Kentness Proofing and you get the Approbation, which, by the way, is a pass-fail examination. There is no ranking system. There is no, oh, if you get these many marks, then you can get this specialization. It's absolutely not like that, which is another thing I love about the German PG system, because we all know that exams can be nerve-wracking, and a lot of students who are actually very good at what they do, very good potential doctors, tend to miss out on the specializations that they want to do in India, especially because they're just bad at giving exams. And I find that very unfair, honestly. So that is one thing that I really like about the German PG system. Now, the FSP exam, just to give you like an overview so that it's not completely foreign to you, it consists of history taking. That is, you will get a German patient who will be an actor, basically, who will be telling you that, oh, I have this problem. And then you have to take the history step by step. And then there will be a case viva, which will be done by doctors. You have to explain the case to them. They will ask you questions related to it, etc., etc. There are about 40 to 50 standard cases that come in the FSP. So again, no need to worry about it. Once you have completed B2, you can start training for FSP, and it'll be easy. There are books available. You don't have to always join courses, which can range from anywhere from €1,000 to €5,000. That is around 80,000 bucks to 4 lakh rupees. So yeah, you don't always have to do that. I know a lot of students who've done it themselves and they've cleared it, so no problem. Again, one part of this examination, which is honestly the easiest part, is that you have some Latin medical terms which you have to translate to German, German to Latin. Some states also ask for German to English and English to German. Again, depends from state to state. Once you complete the FSP, that is this medical German examination, you get a temporary license to practice. Now, let me just explain this to you. It is also known as Berufserlaubnis. Always break down German words before you say them, otherwise they are too scary looking. It's called the Berufserlaubnis. Beruf basically means profession, and Berufserlaubnis means like a professional certificate, basically. And what this does is that it gives you the opportunity to work as a doctor in Germany. Okay, now don't confuse this with an Approbation, because an FSP and then getting the Berufserlaubnis will only allow you to work as a doctor in Germany as you would have worked as an MBBS doctor in India. That is, some people after their MBBS join hospitals as MRs or registrars. So this is similar to that. You will get paid a good amount, but then again, it's not counted as your post-graduation. Like after doing the Berufserlaubnis, even if you work for 2 years, which is the validity of the Berufserlaubnis, that is the temporary license to work, even if you work for 2 years, you still have to do the 6 years of PG. But then again, there is an exception to this. If you are doing any sort of medical or surgical specialization, let's say, and you happen to do, let's say, like a medical temporary job, okay, you get your Berufserlaubnis, that is the temporary license to practice, and you say, okay, I got a job in internal medicine, I'm going to go over there. After this, if you plan on doing a surgical specialization or a super specialization, then this amount of work, whatever you have done for 2 years, will not be counted in the post-graduation because you are doing a surgical specialization. But if you get a job in something like general surgery, which is basically what the first 2 years of the super specialization or the PG are, like they are just general surgery things, then it is counted, but it is not counted 1-to-1. That is, if you have done 2 years of work after getting the temporary license to practice, then you might not always get just 4 years of PG. They might tell you that, okay, so you worked for 2 years, we'll consider it to be 1 year, and then you can do 1 year in our hospital. So it's shortened by 1 year, basically. So it's a bit complicated, but we'll come to that when that happens. Now the next step is the Kentness Proofing, the KP, or the Approbation test. And this you have to do within 2 years of getting the Berufserlaubnis. As I said, the temporary license to practice lasts for 2 years. So basically, you have to give the Kentness Proofing examination within 2 years of giving the FSP examination. And this is sort of like a knowledge test. Like in some states, it's just oral, in which it's just sort of like a grand viva. 3 doctors sit in front of you. They can ask you about cases. They can ask you about general medical topics. Other than this, in some states, it can be like specialization oriented. For example, if you're applying for ophthalmology, let's say, then they'll ask you a lot of questions about ophthalmology just to test your basic knowledge of ophthalmology. Of course, they don't expect specialization level knowledge, but they do expect basic knowledge. And in some states, it can also be written. But the written test is more of like an MCQ sort of test, in which they just test some of the areas of like internal medicine, radiology, emergency medicine, general surgery, etc. Again, as I said, there is a lot of state to state variation. All of this can depend on the state in which you're planning to give the Kentness proofing. So if the Kentness proofing has a written examination, the topics that it covers are internal medicine, surgery, pharmacology, diagnostics, and basically all other MBBS subjects. And the reason, like, it doesn't make sense if I say this, and all other subjects. The reason I'm mentioning all other subjects in the end is because these four, that is medicine, surgery, pharmac, and diagnostics. Diagnostics includes radiology and pathology. So these four are given the most importance because they think that if you have good knowledge of these subjects, then okay, like you can deal with the other things. So these are the main four subjects. The practical exam in a Kentness Proofing, that is the Approbation test, consists of history taking, patient examination under supervision, similar to the Fachsprachprüfung. And then there is a case presentation and a viva voce by 3 examiners, as I said, which lasts for 45 to 60 minutes. And this is not something that I think we should be scared of, because I think in India, we are used to giving really long viva voces, because in Germany, it's very odd for them to do this because their vivas are like very short, 5 to 10 minutes. But I have sat through 45-minute vivas in my MBBS. So I think this should not be a problem, except the fact that it'll all be in German. This is something that you need to remember, which is why I always say, start learning German now, right now, today. So again, also includes the grand viva on all other topics of MBBS. Now, before moving on to the alternative paths, I just want to ask, are there any questions?
Yes, ma'am, we have few questions. I will let you know.
Yeah.
Just how difficult is the entrance to Germany, and how early on should one start preparing for it? For example, a med student like me who just joined third year.
Okay. So firstly, coming to the difficulty part, the language is honestly the most difficult part, I would say, because if you clear your language and you have worked in a hospital, which was another question actually previously, that does the work experience need to be from India or Germany? It needs to be from Germany. And you don't have to have like a formal job. You just have to do a hospitation, which is basically like you work in any department for 2 to 3 months. Because if you directly try to enter into the specialization, they are then going to tell you that, okay, we need you to work in our hospital for 6 months, and then you will have to do that. So instead of that, you can do it early on while you are learning your language, because a little bit of language, that is A1 or A2, can get you through the hospitation. So then that way you're not wasting time. Now coming to the difficulty part, as I said, when you're doing the hospitation, you tend to know a lot of doctors, you make a lot of connections. So that way, when you're actually applying for a vacancy, you have a lot of leads to apply on. Because if you're sitting in India and you're trying to apply for a position in Germany, which is something that I have noticed, and I don't understand how anybody expects someone sitting in another continent to give them a job based on nothing but a CV with no knowledge of their work. It's a little bizarre. That's why it's very, very difficult to do that from India directly. Because everybody wants to see how you work. So for example, if you apply from India, then maybe you'll have to apply to like 100 vacancies, and then you might get like a call back from like 5 to 6, and then you might cross the interview in maybe one. But if you are in Germany, for example, I did my hospitation in the University Clinic of Dresden, and I have worked with neurosurgeons, I have worked with general surgeons, I have plastic surgeon friends. So that way, now I know at least if there is a vacancy, because sometimes they don't post it on the website. They just go by word of mouth. And when I say word of mouth, there is no preference to anyone, trust me. They want to see how you work. So if you have worked in the hospital, then you have a big advantage over anyone who is applying from halfway across the world. And coming to when you should start, the alternative paths actually sort of deal with the paths you can take depending on when you're starting it. But if you're in third year, I would say that it's still a perfect time to start. You can just start learning the language, and in the last 2 years, that is third and fourth year, you can complete learning the languages. You have much more time than anyone who has completed their MBBS. And this is something I really like to focus on, because a lot of students give up because they say, oh, now I've completed my MBBS, now there's no time, I can't prepare. You still have a year, because I know that in India, a lot of students give NEET PG thrice. So like if you are ready to do that, then I'm sure you can take 1 year to brush up your German skills. And if you're in third year, start learning the language now. Start applying for either research positions or hospitations to German hospitals. There's a lot of noise, Tarun. Very soon I will be also talking about hospitation in Germany, because I know a lot of students don't know about this. But yes, I can't cover that today because I mean, we are very close to 1 hour. So yeah, if you are in your third year, start learning language now. Start applying for hospitations, and just get an overall idea in general of working in Germany, either by coming here for any sort of conference, or, as I said, hospitation. So coming to the alternative paths, which is what I am on right now. So you can either take a PhD, because I know that many clinical PhDs in Germany and in the Netherlands are very valuable. Because if you have a PhD in a clinical subject, then when you're entering your post graduation, that is your specialization, then you are given special preference, because they know that firstly you're good at research, secondly you've worked in the clinical field, even if it was through research. So you are given some sort of preference. And this is something that I would suggest to someone who thinks that they are going to take a lot of time in learning the German language. So in the meanwhile, you can do a PhD, which lasts for about 3 to 4 years. And trust me, like, time isn't going anywhere. Most German people start their specialization and super specialization when they are anywhere from the age of 25 to 30. So trust me, like, time isn't going anywhere. It's on your side. And doing a PhD in Germany is honestly very fun. Research in Germany is fun in general. You can also do a master's in public health, and this is for someone who is not sure about their interest in research, but also has the financial ability to support this degree. Because, of course, there is a sort of myth that all degrees in Germany are free, but especially English degrees in Germany, 50% of them, I would say, are not free. Yes, some of them are very cheap, but most of them are not free in Germany, English speaking courses. So, yeah, if you have the financial capability, then sure, go ahead and do a master's in public health. That way, you can move to Germany and you can sort of get an idea of how it is. You can start making connections at hospitals, come to know about the vacancies, etc. And yeah, at least you're not wasting your time, because I am honestly the kind of person who cannot sit free for 1 or 2 years, even if it means that I'm preparing for something. I need to either be getting a degree or I need to be on a job. So for me, primarily, I would go with some of these options if I thought that I was going to take time. But sure, if you are living in India, and in India you want to work on some job, or you just want to sit at home and prepare for German PG, that's also completely fine. Because they are not going to ask you that, like, oh, why is there such a big gap in your CV, which is also the concern of some students, understandably. But German people understand that, okay, you were learning the language, and okay, like, we can let it pass, as long as you don't lose touch with your clinical knowledge, of course. And as I said before, there is also the temporary work license. So you can always work as a non-PG doctor, that is after getting your Berufserlaubnis. And this, I'm saying, is an alternative path, because a lot of Indian students, because we love giving exams, so what they do is that they give FSP and then they start preparing for Kentness Proofing, and they give Kentness Proofing, and then they think about, like getting into like a job or something. It's just exams, exams, exams. But you don't have to do that, is all I'm saying. So over here, I've sort of laid out what you can do on the straight line. As you can see, is the general way of like going about it. And when I say general, it's by no means the most common way. It's just that this is the path you would take if you would give exam after exam after exam and then just get into PG.
Ma'am,
But
can
yes,
I ask questions now, or after this? Can I?
I can stop after like 5 minutes,
Okay.
if that's okay. Yeah. I'll just complete this. So this is the main path. Other than that, of course, as I said before, the public health thing, and the PhD thing. And other than this, you can also directly complete C1, and you can give the approbation exam, and then you can start residency. Because if you complete C1, it automatically includes medical PG level German. So then you don't have to give the FSP. This is something that a lot of people get confused about. If you give the B2, you have to give the FSP, you cannot skip it. But if you give C1, you don't have to necessarily give it. Yes, questions.
Yes, ma'am. Like, the first question is like, how much is the salary for non-PhD doctor in Germany? Can we manage the expenses and the salary?
Yes, definitely. Germany is the kind of country where they won't let you stay in the country if your salary is not going to manage your expenses. That's the first thing. They have a minimum level of income that you have to have, that is around 940 euros a month, I think, which is more than enough for someone living alone in Germany. But as a non PG doctor, you can get paid anywhere from about 1800 euros to again 3000 euros, because you are working as a doctor, and you can work in private clinics where you get paid more. So yes, it's more than enough.
Yes, ma'am. Like, next question is like, what are the criteria to apply a PhD? Like, after MBBS, the language certificate criteria, and is how to apply, and what is the salary, and that's it, ma'am.
Yeah, so for PhD, you don't need language, because PhD is done in English. and you don't need language for that. So that is exactly why I say that get a PhD position if you can, because then side by side you can learn the language. The salary for a PhD position can vary anywhere from about 1,000 euros to 2,000 euros, I would say. For example, if you come through the DARD program, that is the DAAD, they don't usually accept MBBS students, but if you happen to get accepted, then they pay around 1,200 euros a month. On the program that I was on, I was getting paid 1,000 euros a month during my doctor med. But of course, it was a doctor med. It wasn't a PhD. A PhD is like 3 years. A doctor med is like 1.5 year, and it's considered to be like a student course. That's why the pay is lower. So yeah, I think that answers the question, right?
Yes, ma'am. Yeah, he is asking like, can we do PhD without post graduation after MBBS, as you said in Germany or Netherlands?
Yes, you can. Immediately after your MBBS, you can apply for a PhD position anywhere in Europe. There are many, many, many good labs in Europe. And honestly, that sort of allows me to talk about this as well, because GCMER is trying to sort of form a network of the research labs in Europe where MBBS students can go and do research. And for that, you just need to be MBBS pass. That's all. You don't have to give any exam or anything, but of course, you have to have some research knowledge. Some publications are preferable. But if you can show that you have worked on a bunch of research projects, even if you don't have publications, it's okay. Like, it's not a problem.
Yes, ma'am. Like, like it's my question. Like, how much monthly, I mean, expenses you have roughly in Germany?
Yeah, I can answer that. So previously I was living, like, starting with the stay. Previously I was living in a dormitory, like it was part of like a hostel, but it wasn't like shared rooms. It was very good. I was staying alone in a room, but the amenities were shared, like the kitchen and the bathroom were shared. So over there, I paid like 180 euros a month. Now I'm living in a 1 BHK, which is like a proper bedroom, hall, kitchen, like two separate hall and kitchen areas, which costs me around 500 euros a month. If you take a studio, then it can cost you around 300 to 400 euros. And I am saying all this in Dresden, which is the capital city of Saxony. But at the same time, it's not as costly as cities like Berlin and Frankfurt and Munich. Those are much costlier cities. The smaller the city, the less costly it's going to be. And I would say that Dresden, while being a tier one city in terms of like Germany, it is one of the cheaper tier one cities because it's in the east and it's not as international as the other cities, because over here the only international thing is the technical university where a lot of Indian students come for their masters, etc. But no, in general it's not very international. So that is the living cost. Other than that, I would say that on groceries, I mean, like, I don't think that this is the average thing. I think this is lower than average. But groceries cost me around 100 to 200 euros. I would say that in general, including the travel, including groceries, including living, including some expenses you might have here or there, I would say around 700 euros. If you're planning to stay in a 1 BHK, which is honestly luxurious because you don't really need a 1 BHK. You can very easily stay in a studio or you can share a place. So then in that case, it'll be like 500 euros. So not a problem.
Yes, ma'am. Like, we cannot again keep a financial burden on parents while doing a PhD in Germany. So like, that's why I want to confirm. So I
Yeah,
think
yeah, absolutely. Absolutely. Because I personally believe that immediately after my MBBS, I was like, out of the house, and I made sure that I was able to pay for my expenses. I personally believe in that. No judgment to anyone who does not do that. That's okay. But yes, if you have a salary of more than, let's say, 800 euros, then you'll be fine. Shouldn't be a problem.
Ma'am, next we have one good question. As of now, which countries can we practice in after getting a German PG? Like in Europe, any other countries, or can we move to German to US or any other countries?
Yeah, so if you have a German PG, you can practice anywhere in Europe. Okay, that is the first thing. But of course, Europe is a very diverse continent, because there's like different languages which are spoken. So to do a complete shift of career, you would have to pass the language exam of that country. That is necessary because the patients in that country will speak that language. But then again, it's not that difficult to learn a language, so it should be fine. But one very good thing is that if you do a PG in Germany, then if, for example, you want to go for a fellowship or something, or if you want to spend 1 year practicing somewhere else during your specialization, you can definitely do that. I have seen doctors who do that because that doesn't really require much of language knowledge. And about going to the US is very strict in who can practice there, who can't. Because I know that a lot of German doctors have gotten very angry about this because they say that our training is better than the US, but US doesn't allow us to practice there. So yeah, in short, US requires USMLE, even if you have a PG from any other country. Trust me, like they are very weird like that. They don't think that the like the PG of any country is as good as their country, which is not true, by the way. It's not true at all. So they require you to do the USMLE, and then they require you to repeat the post graduation in the US. So yeah.
Yes, ma'am. Like one more question is like, let's say an MBBS student has completed, go to German, has done his PhD and done his PG. Then at that time, let's assume that there is no decision on allowing German PGs in India, like to practice, but still, whether we can practice based on the MBBS we got in we got in India, and what is the valid of PhD which we got in German? Well, PhD in German is acceptable in India to apply for any research scientist positions or something like that.
Yes, so I think it was a couple of like mixed questions. Well, if a post graduation is accepted in India by the time you complete your post graduation in Germany, then it should be accepted. I don't see why you wouldn't be able to practice. Now, coming to the PhD part, whether any research position in India would take you, yes, 100%. Because it's known that in Germany, research is very good. The research programs here are very good. A lot of Indian students, whether MBBS or not, try to get a research position in Germany because, again, like it's very good. I have a bunch of Indian people in my lab as well, who are doing a PhD, and they are not sure about whether they want to go back to India or they want to move to Sweden or all this, because doing a PhD in Germany opens opportunities for you to go to a lot of countries. So that's another thing. And yes, India does accept German PhD, because the only reason India is iffy about German PG is because of the licensing part. That's all. And I'm sure even that shouldn't be a problem in the future.
Yes, ma'am. Like one more question is like, madam, what would you suggest, German PG or UK PG? And let's think
Hmm.
that we have completed the German PG. Can we move to London or UK and can we practice there?
Yes. So to move to the UK, if you have completed German PG, then you have to give one examination to get registered in the GMC, that is the General Medical Council, or like I don't know what it is, but it's called the GMC. I know that because many of my friends are pursuing PLAB. So yes, you just need to give that exam. You don't have to repeat your post graduation, and then you get registered as a specialist over there. And this is also true for Australia, by the way. If you complete your PG in Germany, then you can just give one exam, I think, to get registered in Australia, and you can practice over there. So that's one thing. Now coming to the UK versus Germany thing, I have spoken about all the advantages and disadvantages. I mean, it doesn't matter to me whether you take German PG or UK PG. Nobody is going to pay me for that. So I prefer German PG. I can tell you why I prefer it. It's because I feel like German PG is based on a lot of merit. It gives opportunities to people who deserve it, because if you're good at what you do and the people see it, then you get a chance. In UK, the problem is that there is honestly so much competition, because obviously like English is like, you know, our first language almost. So the language is not a barrier at all. So there is more competition for sure. And then you have to go through a longer process. You have to do at least 1 or 2 years of foundation years before you even start a specialization. And then getting into the specialization you want again is an issue. Also, super specialization takes 8 years in the UK. So these are some of the differences between like German PG and UK PG. UK PG, if for example you want to become a cardiologist, it'll take you like 8 years. If you want to become a neurosurgeon, it'll take you 10 years. And yes, it's just there's lesser chance that you will get the specialty you want. I would say, as a thumb rule, if you don't care about the specialization you get, if you care more about just living out of India, then go for UK. Because then you'll get some specialization, maybe not your choice, but you'll be living a good life with a good pay as well. But if you're very specific about the specialization you want, then come to Germany, because Germany weeds out a lot of people who are just applying for the sake of it, because the language is quite a screening factor, I would say. Only someone who is very dedicated would learn the language to actually move to a country. So I personally chose Germany because I love the surgical techniques they have over here. I'm very specific that I want to enter surgery. Maybe I'll change my mind in a year, I don't know. But for me, the specialization that I enter is more important than the place that I live in. So that's why I think German PG is better for me personally. I'm done with my answer, I can say.
Yes, ma'am. Sorry, small connective issue. I have reconnected.
Mhm.
Ma'am, a small request. Like we have our JP partners as an education. So while you answering the questions, can I share the PPT of them? So they are requested me to do for every session. So we still have few questions. So you can
Yeah,
take
yeah,
them.
no problem. No problem. In the meanwhile, actually,
Hmm.
what I'll do is I'll just share. Um, you can start the JPPPT if you would like. I'll just share the GCMER membership form. And also, I would like to say that I know that officially we have closed the deadline for applications for our global team. That is both for ambassadors and the team as well. But anyone who is attending this, if you want to apply for a position, then feel free to do that. I am going to put in the link for the application over here. You basically have to send us an email, but you can go through the list of you can go through the list of positions available through the PPT that we have, and you can see the plan that we have, etc. So then you can decide to apply if you want. So Tarun, can you put this in the YouTube chat?
Yes, ma'am. 1 minute, I will.
Yeah, and I'll also put the membership.
I have placed it in YouTube chat, ma'am. Like, is there anything further to place?
Sorry.
I have placed the link in YouTube chat, ma'am. Is there any further things to place there?
Yeah, I'll just put the membership link, because to apply for a position, to get a position, I'm saying you need to be a member. You can apply for a position if you're not a member, of course. Feel free to do that, and you can start the JPPPT.
Yes, ma'am. 1
And
minute.
in the meanwhile, how can I see the questions that are being asked?
Yeah, if you have YouTube link, you can see, ma'am. I will ask, ma'am. No problem. I will manage both. So, 1 minute. You just give me 1 minute. No?
Yeah, no problem. Take your time.
Now we have a question. I have finished my MBBS and have completed my B2 level from Joy. What visa should I apply for?
Well, if you have completed your MBBS and also your B2 level from Goethe, then you should apply for an FSP if you want to get into German PG. But if you want to apply for research, you can apply for any research you like. Feel free to apply to my lab as well. I'm sure I can talk to my professor and ask him if they have positions available. My professor is pretty well known in the field of ENT and neurology and smell and taste. So if you want to like work from a reputable lab, then feel free to drop me an email or something. But yes, when you say which research lab should I apply to, was the research lab a question, or was the research field a question?
Visa, ma'am. What visa should I apply for?
What research?
Visa, ma'am.
Visa. Okay, sorry, I heard that wrong. The visa you should apply for is, as I said, you can apply for a job seeker visa, in which you can come to Germany, stay here for 6 months. In the meanwhile, you can also give FSP and then get a job. But then, as it is like a short-term visa, you don't have a very long time to, get everything you need to get. Other than this, you can also join some sort of a medical German course since you've already completed B2. So you will be eligible for the medical German courses over here. And you can enroll into one of the language schools like the medical German schools, and you can apply for a language visa. There is a special visa for that. And yes, you can also apply for a Shenzhen visa and come over here and give the FSP if you would like. Depends on how confident you are. If you have a date for the FSP, I would say that just apply for a Shenzhen visa, tell them I have an exam and come here and give it. If you don't have a date for an FSP, and if you're still waiting on your certificates and your degree to get validated, then I would say apply for a job seeker visa.
Yes, ma'am. We have next question. Mm, which city or state would you suggest to pursue surgery as a residency program in Germany?
Any city. I would not say that one city is better than the other. I would say that it would be better for a surgical specialization to pursue the post graduation in a university hospital. There are 12 university hospitals in Germany, and I think 12. Am I confusing it with the provinces? I don't know. You can check it. It's available online. But pursuing it from any hospital is fine. And let me just like reiterate that when I said that getting the specialization you want is easier, I didn't mean that there are vacancies everywhere and you'll get a choice of like, oh, should I go to this hospital or that hospital? That is very, very rare. There are very rarely vacancies, but there's a higher chance that you might get a vacancy in the field that you want. So I would say that just take any hospital you get. Don't worry about it. All of Germany is good to live in. All of Germany has a good surgical program. Don't worry about it.
Yes, ma'am. We have completed with questions. We can wait for 30 more seconds. If we get any questions, we can answer or we can end the meeting.
Yes, no problem. Well, did I have to say something?
No, ma'am. I will give the note.
No. I was just thinking that I think, oh, yeah, no, I wanted to say that if someone is planning to apply for the hospitation, just drop us a text on our Instagram, like the GCMER Instagram, because that's what I use professionally. Because I am on the edge about doing a webinar or making a video on hospitation. So if enough people want it, then I'll definitely do it. So feel free to reach out to me for that. You can do your outro now.
Okay, ma'am. I think we have no more questions, and we got around 800 views, and we will get some more in here because students are packed up with online postings, online class, and they will refer meanwhile. So thank you so much, ma'am, for the very insightful session. Like it was quite informative and engaging. I hope people who are interested are full will get knowledge from this session, and they would plan according to their possibility and their time and etc. So if any questions, please feel free to reach madam through the email which you have mentioned, or feel free to contact GCMER Instagram page. So you can simply type GCMER in Instagram, you can find, or you can message us and we can send you the page link if you want. So, ma'am, could you suggest reaching you personally through Instagram or for any doubt?
Yeah, you can also reach out to me on my personal Instagram, that is dr.oshinbehl, dr.oshinbehl. You can always do that. I answer a lot of questions. One suggestion is that if you're going to send me a message, please don't just say a hi. I'm not saying that, oh, it's unprofessional, so I'm not going to reply. It's just that I don't know then like why you are messaging me. So there's a very high chance that I will not reply. So just start off with your question, write your question, and if like I'm able to answer it, if like there are a lot of similar questions, I might do a live, and I tend to do that sometimes. So yeah, thank you, SMR and Medinvade, for having me. It was a pleasure to talk on this platform. I spoke after a lot of days about German PG. I think almost like 6 months. I had been talking about research a lot, but yes, German PG was missing. And I honestly, it doesn't matter to me how many views we get, as long as the people who view it get something out of it. That's what matters to me. And then again, of course, I hope that as many people as possible benefit from this. I will be sure to circulate it amongst our members as well, which are, by the way, 400. I didn't know that they were 400, not 380 anymore, 400 members. Okay, great. Thank you, everyone. Bye bye.
Thank you so much, ma'am. It's great to have you here, and have a nice day.
Thank you.